So, I mean, Ali's, really hit the nail on the head there. I think one of the things to say is that lifestyle interventions as a treatment are recognised in healthcare, but at the moment, it's sort of the treatment that you give when you're a bit further down the line. And what we're trying to flip is that thinking of why do we wait? So, as cardiologists, unfortunately, we are obviously seeing people and treating people with things like bypass surgery, or referring for bypass surgery, stents, as Ali's touched on, or offering people things like cardiac rehabilitation after they've had a heart attack. And what we're trying to look at is actually the role for intervening with lifestyle changes earlier, before people get that far down the line. And that's something that Ali and some of the groups in Bath have been looking at recently. You may have heard of the cardiologist kitchen. There's been some background work here, in ways that we can address some of the underlying conditions like diabetes and high blood pressure with lifestyle changes. And there's been some really impressive local results. But to try and implement that across the NHS into sort of a routine practice that's available when we see somebody in clinic and we think, actually, you are at high risk of a future heart attack, it's difficult, and it needs research to support that. And that's really what this is about. And it's about recognizing that lifestyle change is difficult. If it can be supported by healthcare, we are likely to increase the chances of that change. And we can see some really quite phenomenal results for the patients that go through it. And that's really what super rehab and the research we're talking about is going to be about.
Yeah, and that for me, I mean, we get into bad habits, don't we, as human beings, and it's trying to break those bad habits. And one of the ways to turn that behavior around is having the knowledge and having the research. So can you tell us a little bit more about why we need more sort of heart health research, and specifically how it's based on lifestyle interventions?
So maybe I'll start. So, I mean, cardiovascular research has been the major focus of actually clinical research worldwide for the last few decades. If you look at the way that we've kind of really evolved our treatment of these conditions, a really good example is atorvastatin was the first mega blockbuster drug of all time. Pfizer actually, I think there was some kind of phenomenal figure. They generated about 100 billion in revenue from that drug, and I think that reflects to you both the scale of the problem, but the opportunity in terms of improving things. And I mean, everyone recognizes, and I think if you ask anybody and you talk about the power of food and exercise to keep you healthy, everyone recognizes that. But in terms of healthcare priorities, it's almost as if it's been relegated to a third tier behind the proper treatments like operations, drugs, and then